Hello, this is Dr. Nathan Way, and this is tip number 3 for arthritis treatment, fixing osteoarthritis with stem cells. The first thing I'm going to talk about is cartilage, because cartilage is where it's at. Cartilage is a gristle that caps the ends of long bones. It consists of two ingredients: matrix, which is the substance of cartilage, which is made up of what are called Proteoglycans. These are proteins and sugars, along with collagen. And then inside this matrix are cells called chondrocytes. These are cartilage cells that actually make matrix. So if you could sort of envision in your mind jello with grapes inside of it, that's what cartilage looks like. Osteoarthritis is due to a breakdown of the matrix for whatever reason. And what happens is that the chondrocyte becomes abnormal. It makes destructive enzymes, which break down cartilage, and this leads to more inflammation with subsequent destruction of cartilage. Now, mesenchymal or adult stem cells are what we're going to be talking about in this series of tips. These are derived from a number of different organ systems, including bone marrow, fat, and a few other areas. And what makes stem cells work, what makes them multiply and divide, are various growth factors that come from platelets and other cells in the blood. And these growth factors have names like fibroblast growth factor, platelet-derived growth factor, transforming growth factor, and fibroblast growth factor, and there are many, many others. The ability of stem cells to work in an individual patient are determined by a number of different factors. I think these four probably are the most important. They're the age of the patient. We know that the older a patient is, the less responsive their stem cells are, and we have an age cutoff of 75 years. The body mass index, or BMI. How heavy a patient is in relationship to their height, the extent of cartilage loss. The more cartilage loss there is, the less likely we're going to be able to regenerate a lot of cartilage. And finally, and probably most importantly, the expertise of the center. For resources about stem cells, I am going to list these two websites for you: www.arthritistreatmentcenter.com and www.arthritistreatmentandrelief.com. Thanks for watching. This is Dr. Nathan Way.